G'day guys, just want to do a quick video here about those recovering from sinus surgery or any kind of upper respiratory operation here. I'm about 1 week into my recovery and I just wanted to share a few tips with you, primarily about how to use the nasal wash and sort of some of the techniques I've used, and maybe just to put your mind at ease about how much force you should and shouldn't use a little bit. That being said, I'm not a doctor, but if you're really worried about things that are happening up there, please go and see a professional that did your operation. Okay, basically I had the works done in here. Pretty much all the sinus tracts opened up, the tuberances I believe they're called, or something, cut and manipulated and moved, and sinuses worked on, and deviated septum fixed up. Now, it's quite a painful surgery, so expect that. Also, once you're out, usually probably an overnight stay in hospital, you will experience some bleeding. Most likely once you leave, it will start. Usually, if it's too much, it will last a day or two. The doctor will tell you this. However, it should start easing after a few days. Mine actually lasted about 4 days. What I found with this is that you tend to get blood clots that sit in the back of your sinus area and your nasal cavity, and if you don't get these out, what you're going to find is your body will try and push them out, and part of the bleeding process is that. So this is why the sinus wash is quite important for a number of reasons. It helps keep the area clean, comfortable, etc. But it will also help you get these clots out as well if you can do it properly. I'm going to demonstrate a sinus wash. I don't have as much gunk in there as I had over the past week. I still have some gunk in there. My doctor's orders was to not blow through the nose. I have still like some kind of medical implements in here, stints to keep the gaps open and things like that. So I can't blow through my nose very effectively, and nor have I tried greatly. So the way I do it is I squirt this in at various angles, and sometimes even rightly, just close to the nostril and up. And what I'll tend to find is a lot of gunk will flush out. You've got to have your mouth open and your head down, something along the lines of this. Okay, I'll do it the other way, sorry. Okay, now I'll just demonstrate this for you anyway. But what you're going to find, you can also take a breath in. If you're lucky enough, after a few days, your nasal cavity will open up a little bit if it hasn't already. One side is usually more blocked than the other, so don't be alarmed at that. What you do need to find is if you do have something that feels blocked in there, try and work on that a little. But the nasal cavity that's not blocked, you can potentially do a light breath in to try and pull that water, salt solution back into your throat and sinus area, and really, like you're doing a big spit, like and so on and so forth. And so you'll be able to do that. Now, I'll demonstrate it. It's not pretty, so here's your warning now. If you like any spitting sounds or any kind of blood-looking thing, you can sort of see a little bit starting to come out my nose there. But yeah, you'll find that many of the doctor's orders, they'll give them to you, and they'll give you information pamphlets and things like that. But don't, like, on a general basis, the head forward usually causes more bleeding. Mine's finally stopped after about 6 to 5 days. It pretty much really slowed down, and then now I'm on my 8th day since the surgery, 7.5 days, 8 days, and now that the bleeding's basically all but stopped. So I do get clusters in there, and I'm spitting out a lot of blood still, but it's getting better, and you can really feel the differences. At the end of this video, I will tell you some couple of supplements I'm taking after the antibiotics, but bear with me, I'll get this done. It's a little bit of a messy process, so bear with me. I usually have some kind of absorbent material nearby, toilet paper, tissue, whatever, because at the end of it, you'll just want to do a quick sort of general wipe up. Okay, get this out of the way. Right, it's pretty bad, so here we go. I'll actually block the sink, and if I feel disgusting enough, I'll show you what comes out, but not much will on this one. Okay, so you can see how I'm breathing in like that to try and release anything that's in the back of the cavities there. I'll try the other side a little bit. Breathing out my mouth as I do this, and occasionally breathing in the nose cavity. What I tend to find, excuse me, is that these things never last long enough. Some of them are bigger than others. This one's a little bit small, so don't be afraid. In this case, I did it with both nostrils, but sometimes I'll focus on one, refill it with the salt solution again, and do the other one, or both, however. So yeah, don't be afraid to use more than one. Now, for those that are squeamish, I'm just going to clean up a little bit here before I touch my phone. But I'll show you just what's come out of this, and it's nothing spectacular. To tell you the truth, there's been a hell of a lot worse. So I'll just get this sorted. And now if you've done a really good job of breathing that solution back into the back of your throat and trying to expel stuff through your mouth, you'll find that water will still stay up there. Sometimes if you stick your head forward, if you've done a really good job, and then it'll just start running out a handful of drops. So just be aware of that. So if you get this constant dripping after it, it's probably because you haven't tilted forward a little bit to let some of that solution out, or you haven't spat it out enough. Okay, so here's a warning in 3, 2, 1. I'm going to show you this now. It's I'm just doing it on the camera. So that's not that much really. It's pretty gross. So I'll stop that. Oh, there we go. You can see the dripping there now. So it's coming out a little bit. Right. So I'll stick this back here and try and act normal again. Get rid of that, even that disgusts me. But yeah, what you'll find is you'll usually have a few blood clots, and there'll be 1 or 2 big ones in there lurking around, and they'll be the hardest ones to get out. They won't come out for a few days, but once they do, you'll notice quite a difference in maybe if you're bleeding a little bit or whatever, that you'll find that that'll settle down pretty quickly. In saying that, I'm not a doctor. Consult them if you're having worries, but it's easy to get worried. I've already called mine once or twice because I thought, well, he told me 2 or 3 days to stop. Mine took 5. So everyone's normal is slightly different. Right, now, once you've kind of cleaned up and settled yourself back down again. Oh, phone. Oh, front away phone. Sorry. Okay, once you've settled yourself down again, basically you clean up and carry on with the rest of your day. My orders was to do this 4 to 6 times a day. And it seems like a pain in the ass, but you've got nothing else to do and you're not really going out. So you're pretty much trying to sit down and relax and not do too much. Just chill out for a week or so. Then you can slowly start moving around. I find it a bit hard to eat, especially and laugh profusely. Like if you're smiling a little bit, too big of a smile really pulls in here. But once again, it depends on what you've had done. Because I've had the whole works in here and I've got bits of plastic or metal or something going on through here. My case is probably different to some. But in saying that, yeah, look, it will hurt a little bit around your nut. It's quite sensitive. And to even put it in perspective, a pillow moved itself and fell on my face, and that was like Mike Tyson punched me in the face. It bloody hurt, right? So it is quite sensitive for a fair while. So yeah, just take some kind of Panadol, pain relief. They'll tell you about that stuff. What I'm doing after the antibiotics finished, I've got a brand of vitamin C. It's a time release buffered vitamin C from the Now company. So I find that's a very good brand generally. So I'm taking that at night, maybe in half an hour before I go to bed, something like that. And then I also take some branched chain amino acids, like a bodybuilding supplement. I only take a couple. You could probably take 8 or 10 of these things at a time, but I only take 2 to 4. I don't take that many. And I might take 1 or 2 of them a day, like doses of 2 a day. And then I try to eat very healthy. You're going to find you need soft foods. Eating like toast and stuff is capable, but it takes you 3 or 4 to 5 times longer to eat something than you would normally. So just be aware of that. Also, those are the 2 I find that the combo, they're working quite well at night for me to take those supplements. And then I just take the vitamin C also in the morning, and then I have sort of a gap period in the middle of the day where I don't do anything. And maybe every second day after the antibiotics, I'm taking a good multivitamin. So get a good one, especially if you can find it organic stuff. Anyway, check it out. But yeah, your body is healing. It's using a large amount of resources. So, you're bleeding. So you need to replace all the trace minerals. So I tend to use Himalayan rock salt a bit. You'll find you'll probably crave that. You might not have a taste sensation or a smell sensation for a while. Mine's only just coming back, but it kind of goes a lot at the moment. So either way, I can't think of anything else to advise you on straight away. But if you have any questions, just pop them in the comment box below. Excuse me, still dripping. You'll find that this will happen for a few minutes after, especially that I'm just running doing this video and talking too much. Anyway, I think this video has gone on long enough. Thanks for listening. If you like it and it helps anyone, push the like button and maybe share it with someone that you know is having surgery. Anyway, guys, leave your comments below and I'll try and get to them if I can. Bye.